Okay, so as right before getting into the President's report, I wanted to ask for permission to add something to the agenda just before the presentation, which is a Cal Able video that's about 5 minutes long. If no one has a problem with that, we'll just take that as consensus. So yeah, I'm back. Good to be back. Again, thanks for all the messages, gifts, and visits. I really appreciate your patience as I re-enter as well, because I'm working part-time right now, and but trying to get my feet back on the ground and enter the fray. And I assume Ron handled everything impeccable.
It was terrible.
Thank you, Ron.
We're glad to have you back.
And all the else I have to say is have a wonderful holiday and best wishes for a Happy New Year.
You know, we really missed you, Darren. I did tell Darren when he came in today, I said, I knew when you came back to work, and notice I didn't email you the first day, I waited for the second day. So. Anyway, it's great to have you back. This is just a little something from the council. We understand you might have a couple lifestyle changes, so you might appreciate that. Anyway,
All right.
welcome
Okay.
back.
Thank you.
Yes, absolutely. We have a lot of business to take care of today, actually. I wanted to give you a little update on my position. I'm very sad to say you're stuck with me a little bit longer than I anticipated. Now it looks like I'll be here through March or April. It just, you know, the hiring process takes a very long time. So I thought I had done my last transition fair, but here we come, 2019. So anyway, so thank you for your patience. It's not the same as working here, but hopefully you still continue to get all those emails I send out. So speaking of the transition fair, the service provider invitations are set to go, and they'll be going out on January 7th. So you look for those, and then we aim to have the family registration ready by February 1st at the College of Alameda, as usual. Oh, do you see the flyer? Can I grab this because I didn't get myself one? See this flyer, Intelligent Lives? This is a film by Dan Habib. He has a son with a developmental disability, and we are so fortunate to have this premiering tomorrow night. It's great family entertainment. It's appropriate for children 8 and up. This is a collaboration of many agencies led by DREDA, but bringing Intelligent Lives was part of a campaign I started in public health called Commit to Inclusion. And it's been sent out to staff, and if you can make it, it's at the Ed Roberts campus. It's going to be a delightful movie. It follows 3 students as they transition to adult life. So, and then we have Dan Habib, the filmmaker, there to answer questions after the film. So it's pretty exciting. So please come. You can still register. What else? Oh, I think you saw the announcement I sent out about the Tri-Valley Resource and Transition Fair. Yesterday I sent the link for both the provider registration and the family registration. It's a collaboration this year with the Tri-Valley SEPA. So if you're interested, let us know. I put a couple things on the board that I wanted to pay close attention to. I didn't put the date on that one, did I? Do you see the ad hoc committee on UASI? UASI's, and I sent this email out yesterday, it's controversial. They spend money on disaster preparedness, and it's supposed to have a link to terrorism. But in our area, a lot is just spent on disaster preparedness, and they have an ad hoc committee to inform the Board of Supervisors who allocates funding for UASI, a big chunk of change. They're having this meeting on Friday at 9 a.m. I just sent that email out today, and I can't be here, but we really need members of our community, the disability community, there to say, hey, we have needs. Our county is not prepared for disasters, and this is an opportunity for direct feedback to the Board of Supervisors. I did send in a proposal, didn't I, Ron, about a access and function needs coordinator. but it would be best to hear from community members. So if you have time on Friday from 9 to 12, that's the address. And then I'm going to let Ron talk about the Alameda County VOAD meeting, and that is a flyer in your packet. That's on January 24th. They've been on a little hiatus, but thanks to the very hard work of Ron Halog, it's starting up again. So hope you can make it. It's a great community meeting and gathering. And I think that's it.
And so, yeah, we would love to have, how many people know about the VOAD? Only a handful. Good, that's even better. So VOAD stands for Voluntary Organizations Active in Disasters. And what we've been trying to do is get the Alameda County VOAD back up to speed again. We've had visitors from Cadre, it's the VOAD down in Santa Clara, also Contra Costa County and Napa County come on through. And we've got some good examples of how we want to move forward. And as you know, right now we've had multiple disasters throughout our state. And we've learned a lot up in North Bay fires. We've learned a lot from the Butte County fires. And we just want to make sure that as organizations, we're staying prepared for it. So Sandy, I'll be going to that one, I guess, instead of PVAC.
Oh, Ron, thank you.
So, but we have this meeting starting, it's going to be on January 24th. We have a save the date in here, and it's going to be almost like a planning meeting where we have your input. We want to learn from what you want to have as a VOAD. This year, what we're definitely going to be having is more trainings for people, and it's free training. So, you know, I think our March meeting, we're probably going to be looking at active shooter. I know it's not a very friendly one, but I think it's very needed. How do we act if there is an active shooter? What are we supposed to be doing? So, but we'll have a full calendar. We're going to be planning that one. We'd love to have you there.
All right. Great. Any questions for presidents or coordinators report? Thank you. Okay, now please turn your attention to the November 2018 council minutes. Take a quick look. Once you've had a chance to review, we'll take any suggested edits or changes or a motion to approve as is. Any suggested edits? All right, seeing none, I will accept a motion to approve. Dahlia, thank you so much. Is there a second? Thank you, Jane. All right, any further discussion? Okay, hearing none. All those in favor of approving the November 2018 council minutes as presented, please indicate by saying aye.
Aye.
Any opposed? And any abstentions? I abstain. Great, thank you. The minutes are approved. So as everyone earlier approved, we're going to go ahead and take a look at that CalAble video. What's it going to take to get that set up?
Oh.
Is that here?
It takes Claudius running around the room. All right.
And once again, I want to thank Claudius, because when I've been in Medford, Oregon, trying to do things here, he's been down here handling things. So.
Yeah. We need to log in, and the password is on that sticky.
You know, the launch of CalAble is December 18th at the Ed Roberts campus. I've sent that email out. I'll probably send it again. But when we get this video up, you'll notice some board member that's in the video. It's a test, so you have to pay attention.
Can we turn off the light?
Yes, I got it.
All throughout my son's life, we have been encouraged by professionals, both in medicine and the educational system, to try and make our son as independent as he can possibly be. He has a partial complex seizure disorder. It was diagnosed when he was 2.
I was born this way is like the short version, that I was 3.5 months premature, and I have cerebral palsy.
Devin has hypoplasia corpus callosum, so it takes him longer to learn and do things. We don't know if our son's going to work when he's old. We are hopeful that he's able to be a positive contribution to society, but the financial aspect worries my wife and I a lot.
My disability is cerebral palsy. I've had cerebral palsy since I was 2 or 3 years old. There never seems to be enough money to cover more than your basic necessities of life, such as rent or car payment or utilities or food.
Under
And your regulations. Buffering. If you have $2,000 or more in the bank, that can suspend your benefits, it can delay your benefits, and so that meant if a car broke down, they wouldn't have that safety net in order to be able to cover those types of unexpected expenses. And these aren't emergencies that we're talking about. These are the everyday responsibilities of life.
CalAble is a program that is offered to individuals who have a disability. I am so proud of the extraordinary efforts so many Californians put forward to make sure that we have a vibrant, robust program to make sure that we provide Californians, in this case those with disabilities, an opportunity to save and have a much brighter future than they otherwise would have. Individuals, whether they're strangers or parents or grandparents or friends, brothers, sisters, can contribute to the program.
I see it as providing a safety net for him in the event that he has housing issues or health issues anywhere in his lifetime after we're gone.
As more and more people with disabilities moving into the workforce, we want to make sure that they are able to receive their employment without them feeling like there's going to be a risk of them losing any types of services or supports.
One of the greatest beauties about CalAble is the money that you put into a CalAble up to $100,000 is completely excluded from asset tests for government benefits like SSI, SSDI, Medi-Cal, Medicaid.
I think CalAble as a sort of college savings account, but instead of using it for college, you use it for disability-related expenses that are not covered by the state of California or private insurance.
It's kind of like being able to finally prepare for a rainy day instead of just like being caught in one.
We're hopeful again that he's able to have a job and contribute. Yes, thank you. And contribute, socially and work in the society. But it's nice to have some type of comfort to know that there is a process in place to where we would be able to help our son. And even if we are not here, that my daughter would be able to help our son or other family members to be able to help our son without those limitations.
As Californians, as human beings, we care for each other. CalAble, I think, is a statement of human values. It's a statement that we care about our fellow human beings.
That was great. Good job, Jane.
Yeah, well, they did a great job putting that together. I thought it was very good.
Look at that. Sandy, there's an event coming up for the kickoff for CalAble?
December 18th at the Ed Roberts campus. I'll send it out one more time. But it's really a wonderful opportunity. It's been a long time in coming, and we're glad California pushed it through.
Yeah, and I wasn't paying attention to things like that for the last couple months, and I was like, oh, hey, what do you know? I wasn't sure that was going to happen.
Yeah, we got CalAble.
That's awesome. Okay, so we're going to shift into the presentation. We're going to need Claudius again, maybe to get my PowerPoint set up. Thank you. And just as Claudius is doing that, this presentation is mostly on the this California statewide strategic framework for the creation of inclusive affordable housing for people with intellectual and developmental disabilities. It was a year-long effort funded by the State Council.
I need your presentation.
So, it's funded by the State Council on Developmental Disabilities and the Lanterman Housing Alliance, which HCB is a member, and the Corporation for Supportive Housing were the main authors of this report. And it was presented in September to the State Council. It was accepted as final draft, and then they were taking it out for the stakeholders to take a look at and comment. And we expect, so Darren, work. We expect that, and it's the, no, where is it? SSF, right there, the PowerPoint. And we expect it to be approved in January and then released. Right now, I have the final copy here, but I can't really share it. I apologize. We were hoping that we would have it in hand by now. Were any of the folks here at the State Council meeting in September for the presentation? I know Sheridan was, and that was. It was amazing. It was well received. We were very happy with that, and we're hopeful that what we end up with in January is going to look very much like our final product that we presented. So we're going to talk about a couple things here today.
Can you see it, or do you want some lights out? Can you see it okay?
I hope you can see it okay, because I have a lot of notes that I need to be able to see. All right. So we're going to talk about who, so the stakeholders, process. It was a year-long initiative, and the product, which is tools and recommendations. The presentation has a lot of data reported. That was a function of the surveys that some of you participated in. So please bear with me, and don't get stuck in the numbers as much as the themes, okay? And I'll try to do the same. Okay, so as we all know, affordable housing, we have an affordable housing crisis in California, not just for people with IDD, but for the whole state. And so currently there are 30 million people living in California. According to California HCD, which is Housing and Community Development, the state needs to create about 1.8 million new housing units, almost 2 million housing units between 2015, which already passed, we're already in this window, in 2025. And that's just to meet the projected population and household growth that we know is going to happen. And we already know that we're behind in production. This breaks down to about 180,000 units per year, but currently the state's creating an average less than 80,000 new homes each year. So there's already $100,000 or 100,000 unit deficit annually that's occurring in production. In particular, the lack of growth in rental housing supply is directly seen some of the highest rents in the country. So we have in the top 10 high rents in the country. I believe the state of California has six cities or 6 metropolitan areas included, and Oakland has been in the top 5 for several years. Not always there, but San Francisco is always near the top. Santa Clara County and San Jose is always near the top, and LA obviously is always in there. And what's really disarming is this doesn't just affect people with IDD, but for a person living in California that's earning a minimum wage, like this California minimum wage, not some of the local minimum wage, they'd have to work 92 hours per week to afford a median price apartment. So that's the end result of this underproduction. Not to mention the levels of homelessness that we're experiencing. We're seeing increases in homelessness throughout the state. And I still need this, right? Okay. My arm's gonna get tired. So we're experiencing homelessness, and we're also, what I'm most concerned is that we're going to experience higher levels of homelessness within the IDD population, and that's very concerning, thinking about what the perils of, and homelessness is difficult for anyone or any family, and then you add it to someone with an intellectual and developmental disability, and you're just adding additional hurdles and probably more hurdles to get out of homelessness. So that's very concerning. There are many reasons for this lack of housing construction. We don't have to go into all of them, but the dissolution of the redevelopment agencies in Brown's first year, in his second time as governor, was a big hit to local governments. And then we've had tight state and local budgets. So budgets, when it comes to creating housing, budgets were really cut back during the recession. And as everyone in this room is aware, the rainy day fund at the state also didn't allow for budgets around services and housing and all these other things that are key to our quality of life. The money didn't come back necessarily once the economy picked up, and now we've got to get ready for the next recession, and we haven't really recovered from the last. So I'm not gonna. I know it's a lot of doom and gloom right now, but everyone knows that's kind of the situation when it comes to housing right now, and we'll get to some hopeful stuff soon. I want another piece that's kind of critical. It's not a huge impact on the housing need of people with IDD, but I want to just point to the great success of the state of California in closing the developmental centers, and that is, that's added additional folks back into the community, which is great. It's not a great number, but it's great that it's happened, but it also just a lot of resources have gone to that process. And that those are resources that could have been used in different ways over the last 15, 20 years. And again, I'm not arguing that it shouldn't have happened. I'm just pointing out that that's another draw on the system. And one thing that we also have to deal with is now that there is there are no longer the DCs as a place for folks to actually enter. We have aging parents that have their adult children living with them, and because there's a lack of affordable housing, and there also are licensed group homes that are going out of business, and that's somewhat like an aging out process as well. The fewer options are available for those folks who have always lived at home, and we'll get more into what those numbers are and what that potential impact could be. So, who participated in the community survey? Oh, I'm sorry. Back on housing need. Apologize. Of the 39 million Californians, approximately 600,000 are living with intellectual or developmental disabilities, and that's under the federal definition. As y'all know, through the Lanterman Act of 1969, it resulted in a shift from care and institutional settings to more community-based settings. The Lanterman Act created regional centers with advocacy for and delivery of these services, rights and services. And the Act further embraced the concept of choice and the right to live a more independent and mainstream life. That Act plus the changes that are now coming up down through CMS have pushed that even more towards mainstream individual planning and so on and so forth, forcing the system to shift and find ways to meet those guidelines, meet those, well, not just guidelines, they're rules, and making it work so that the system can maximize its resources in serving folks. So today in the regional center, this regional centers serve approximately 300,000 clients or consumers with IDD, and they provide a long list of services that are funded through California DDS. So DDS maintains a collection of data on all regional center consumers, including age, demographics, medical condition, and where they are currently living. According to the 2015 report of this data, 102,755 consumers over the age of 18 were either living in their family home, so 62% of them living in their family home, 16% living independently with ILS, SLS, or some other manner of support in their home, and then 15.2 are living in a congregate residential facility. So tying it to the point from the prior slide, the 62.6% of folks living at home with potentially aging family members, that is a huge concern for making sure that we're developing the appropriate housing and appropriate housing options that will best meet their lifestyle once they have to transition out of their family home. And so we all are aware of the autism wave on one end, and we got all these kids getting through the school system and graduating into the adult care system. And then you've got this aging, you've got folks in their 50s and 60s who are going to potentially lose their housing when their parents are no longer able to care for them. So we have issues on both ends of the demographics. And from what the state's data shows that there are 450, and this was as of 2015, 450 folks who were listed as homeless at that time. The LHA feels that number's very much underreported, and especially since things have only gotten worse, for folks at the bottom who had the least stability in housing over the last 3 years. So that's a key also group that we need to focus on, and they have to be prioritized for all housing opportunities. So what the data doesn't show is, are consumers living where they live out of choice, or is it out of need? Do they have one option and that's it? And that's why, and they're there whether they want to be there or not. And then how many consumers are living with aging caregivers? Again, just to bring that up again, and what's the condition in the horizon for that, that living situation? Without getting into too much detail, it would be nice to know if someone's living at home, how long that they could reasonably expect that housing to continue to be available, because that would help us in our planning. How many consumers live in unsafe, overcrowded market rate apartments facing punishing rent increases? Well, I would argue that in the Bay Area, very few are living in that situation because they've already lost that type of housing. That ship has sailed. But there's many parts of the state where they're just starting to experience that as well. And a lot of our folks who were at risk because their rents were high they've already had to find other places to live, which might be congregate settings or back with family. And then this other issue of, we do have consumers living in licensed group homes who are facing imminent evictions because their housing has been sold to the private market. So the group home is closing technically, which creates a huge burden on the regional center for replacement. And it's the impact on those individuals' lives is hard to even quantify, because that's a big change. They're losing not just the people who were helping take care of them, but the bed they sleep in. So in that, that's the data. Now the community survey, how many folks participated in that? It's a great show of hands. Thank you for that. The survey, which was done last summer, most of the respondents responded within the month of July. And we modified the survey so that 8 self-identified categories could respond. And those categories are listed up here. And you'll see there's actually 9 things up there because there's an other. And we didn't get a lot of responses in the other, but folks did respond. A total of 878 responses were received between July 1st and July 31st. Some additional responses have come in since, and we've continued to update the data through that time, but this reflects the July responses. And you can see the breakdown of the numbers. We would have loved to have many, many more responses. Unfortunately, that's not the case. But it's always something we could revisit this on an annual basis and really try to build these numbers, because the larger the sample, the better the results. Steve?
Would you be so kind as to remind us the scope of the study and the percentage of response as a percentage of the people you sent out surveys to?
Well, we didn't no, this is statewide. We did not send the survey out. It was a link that people could respond to. So we don't know how many people actually received the link, because it went out to, the DD Council spread it out, the State Council did it, through their regional offices. So we know it's a low number of responses. But and I'll get more into what we learned. Okay.
We need more DD councils around the counties, you know what I'm saying?
Yeah. So what we did get, though, is a lot of firsthand experience and opinions from people directly involved in affordable housing situation for the IED community. And while we got some qualitative data, which was fantastic, the quantitative data, which is fantastic, the qualitative stories and experiences were the most compelling. And so we'll get into some of that. Questions were generally multiple choice, and the respondent could list as many options as they wanted. So not everything added up to 100%. It always added up to 100 plus, which was confusing for some when we presented. But we wanted people to not be held to just one response to every prompt. And then most questions also included the opportunity for the qualitative answers. So they were able to add, their personal experiences in here. And what we've really found is those answers provided the illuminating, heartbreaking context to the quantitative data. And we'll get more into that. And there's a lot more of this data in the strategic framework, which everyone will be able to see in January. So we asked one question of every category. What in their judgment was the major barrier to the person with IDD living in the housing of his or her choice? Again, everything was around choice, not just where you found yourself. But and we got responses that obviously lack of affordable housing was number one barrier. Lack of sufficient income was the second one, which those are obviously tied. And then a lack of accessible housing was also a big one. So all the things that we weren't surprised by these responses, but it did, the fact that lack of affordable housing was over 70%, lack of sufficient income was over 60%, and lack of accessible was over almost 40%. I mean, it further illuminated that these, not only were they the most popular, they were dominant issues. And then service providers and regional center staff added some additional things that were helpful, because they were seeing things from the case management side of things. And long waiting lists for Section 8 vouchers was a popular response. And also that many landlords won't accept Section 8. So these are folks who are trying to help people get vouchers, and then once they have vouchers, they're not able to get them into housing because of the lack of landlords interested. And one of the things that also came out of this is, and again, I'm preaching to the choir here, but individuals are not just cases. There was a strong thread of comments that each individual has a unique life experience, and that's required. We're required to have individual housing solutions for each of these folks. We can't do this en masse. We have to be thinking about what's going to be best for each individual, and that's going to maximize the choice and the satisfaction with that choice. So where folks want to where they want to live is the piece here, and one of the key components is we asked what folks value in housing, in whether it's their choice housing, was safety was number one, affordability was number two, and so this was an interesting finding, because we've heard everywhere else that affordability was the major barrier, but safety was the major value, and that's critical, because that's what helps the developing side and the funding side figure out what are going to be the best options. And then obviously proximity to amenities like transportation, and then family and friends was another key component. And so one of the things we want to say is, while 45% of the respondents were living at home, 85% said they would like to live independently, either alone or with roommates. And the barriers are the same ones: lack of accessible housing, finances, and affordable housing. And then what would help them overcome those barriers was 56% said they would they could use additional financial assistance, so that could be in the form of a housing subsidy. And then another was 44% listed additional life skills support. So there were many of the folks who wanted to shift from family to independent living. They almost half weren't feeling ready, which slows down a process of transition as well. And it's something that needs to be addressed as they get older and they may lose their family housing. So then families, this was interesting too. Parents with children living at home, is 81% said they performed unpaid caregiving. 25% said they wanted their child with them for their lifespan, while 52% said they did not. Both for their own and their child's sake. So, which is what we would expect. They realized in most cases it would benefit the child to live independently, their adult child to live independently. And then when asked what was keeping it from happening, the same issues came up. Lack of affordable options. There was an additional 50% didn't feel comfortable with the support services options that were available. So that may require a little more digging to figure out what is that? What's the kernel in that? And then a full half cited insufficient finances. And then for parents with children living outside the home, of this group, 52% had children living alone or with roommates, with another 27% living in licensed group home. And again, this is just the respondents. This doesn't reflect statewide data. And then 62% expressed satisfaction with their child's housing arrangement. So that's 62% satisfied with where their child's living outside the home is pretty good. We could always, it's room for improvement, but that was actually good to see. And then of the parents not satisfied, we asked what the barriers were to achieving satisfaction. Again, they came back to 50% cited lack of affordable housing, 44% mentioned limited finances. So they were unsatisfied not because of necessarily where their child was living or their services they were receiving. They were mostly concerned with that it was too expensive and that it was too much of a drag on their child's financial resources. So that was interesting and interesting to learn. And it just points us to, if there's housing subsidies available, we could eliminate a lot of this dissatisfaction and improve the lives of the individuals themselves. So out of service providers, 61% said they thought their clients were satisfied with their housing arrangement, and of those whose clients were not satisfied, the three most common barriers were, again, lack of affordable housing, insufficient income, and lack of accessible rental housing. So that came up again. Accessible bubbles up from time to time. So it's an assumption that might be, obviously we have tons of issues with accessibility for folks who use wheelchairs and have other mobility impairments. And the accessibility also could impact someone who is blind or is deaf and hard of hearing if they don't have the specific modifications in their unit to address those issues. And so 53% thought their client would be better served living alone or with roommates. but needed affordable housing options, financial assistance, and life skills training. So everybody's on the same page here. Regional centers reported back, and these respondents covered the entire state, urban and rural settings, north and south and central. Case managers, community service staff, and executive management all were part of this sample. And they listed as the primary barrier to housing choice is 96% cited lack of sufficient affordable housing in their area. So that's across the state, coast side, inland, up and down, 96%. So, which we were a little shocked that it was that high, because we had assumed that there were the Central Valley and far north may not have the same issues, but we're finding out that it's pretty constant. And again, and 60%, almost 60% said the lack of accessible housing was an issue. Out of the regional center respondents, 87% said they provide housing navigation services and advocate for housing in their communities, which is the experience that we would have here. 29% help their clients get on various wait lists, and we also know that various ILS and SLS providers and some housing NPOs are also part of that effort. And then 28% supplied subsidies for furnishings, deposits, and other needs. So those are like one-time subsidy payments that help people get to that next housing spot. Developers and landlords were also, they had also responded. And these are not the housing NPO developers, these are some of our partners out in the field, or just anyone who got a hold of this link. Their biggest issues, they want more dependable, more plentiful funding streams in all categories. Those who have experience housing people with IDD reported very positive experiences developing for and renting for those folks, which is also something we already knew, but it was good to have it in writing. And those without experience were interested in learning more about the community and what it takes to house them. So we have other interested landlords and developers out there who don't currently provide housing for people with IDD, but would be interested in doing it. And their main interest is what are the resources that would be following them in, financial and supportive services and so on. So, and I'm wrapping up this section, the real fun part. The LHA staff recorded every single qualitative comment from each respondent. And as I mentioned before, I mean, some of it was very humorous, sarcastic, some was heartbreaking, some was inspirational, because there were folks who were very happy with their housing situation. But one thing we certainly saw, and this may come up again, is folks' satisfaction with either their housing or the housing of their child, or their family member, or someone that they work with, was really dependent on the level of resources that family possessed. So, which is not a surprise, but it definitely points out the lack of equity within the system based on just what resources the families can bring to this situation. And I think and I think that's actually going to get magnified with CalAble. And that's not a bad thing. I mean, if more families are able to do what they can to support their children in finding their first choice housing, I mean, that's fantastic. But we also know that there's a lot of families that aren't going to be able to take advantage of that. And it's going to, further polarize that situation. So when we come down to a housing need number, which it's something that we came up with a housing need number for the statewide strategic framework, but with a caveat that we feel that additional data is necessary to really drill down and plan. But So our housing need number starts, if you want, just using the data that was available, that homeless number of 450 would be the bottom. We need a unit for every person that's currently unhoused, right? With an upper end housing need number of about 20,000 units. And that 20,000 was based on, again, analyzing data on age, where they're currently living, and not just the locality or the jurisdiction, but also the setting, and then what special needs they may have, which we had very little information on that, but it was somewhat helpful knowing their diagnosis. What's really needed is that satisfaction piece and some real each individual person in the system, the 300,000, telling us where they want to live and matching that to where they are. And that will give us a true housing need number, and we'll get to the findings and recommendations now. So what we looked at, there's a lot of research went into kind of the current capital services, capital for services and operating. And so what we already know is available is for capital, there are HUD grants, and that money flows through HOME, HOME program, and the CDBG, which is Community Development Block Grant Programs, which they're distributed locally, but they're federal funds. There's no specific set-aside that we could find in any county or jurisdiction that has these funds for IDD throughout the state. And here in the East Bay, HCB has advocated for that in all of the jurisdictions that possess those funds. And we've had zero luck. And part of that is because these local agencies don't feel they have that level of control over the funds, because they do flow down from HUD. So we're thinking it's more of a federal process. And the other side of that is those funds have decreased annually for the last 20 years. So there's we have to wonder if that's really worth fighting for at this point, and our efforts may be better suited elsewhere. There's also the Federal Home Loan Bank's Affordable Housing Program. Again, no specific set aside for IDD, but those funds are typically found in every affordable housing project. So if we could get some language in there for an IDD preference, that would drive all developers of affordable housing to our system to create housing for us. The California Tax Credit, thank you. Allocation Committee, which is how almost every affordable housing project is funded in the country right now, because it's the main source. It's definitely the main source in California, because we haven't had a good statewide source for a while. LHA's been arguing for a set aside for IDD for the last, well, even before LHA was formed. The previous statewide organization was fighting for this for over 10 years, and we haven't been able to get a foothold. But to be fair, none of the other special needs populations have gotten one either. So it's just generally set up as a disability. You can't get points for special needs housing, so any housing for folks with various special needs. And oftentimes that's paired with some of the other targeted population-specific funding. Thanks, Claudius. And then there's the DDS Community Placement Plan, and then what the Community Development Plan that we're seeing come into play is those have mostly been funded to create housing for folks leaving the DCs or being deflected from the DCs, from the developmental centers. And it's primarily been in licensed group home settings with some variations. But there's been some success in using those types of funds from DDS to buy set-asides within affordable housing developments. And we have one of those in Walnut Creek. It's called Arboleda, and there's 15 units for households with developmental disabilities, which include households where it doesn't have to be the head of household that qualifies. So we have families there who have son or daughters that are the qualifying individual. It's not always the head of household, which is a level of flexibility that most funding sources don't have. And it opens up a lot of opportunities for families who need that affordable housing option. All right, and then supportive services, it all comes from DDS, allocated down through the regional centers. Everyone knows that. And then operating and rental subsidies, we have Section 8, distributed by local housing authorities. CalHFA Section 811 rental assistance program has included IDD in their larger population or targeted population, which is great. It hasn't been extremely useful because of some of the other limitations on the funding, but there are units in the East Bay that have been able to utilize these funds, and EBI has done a really good job of getting that subsidy into other affordable housing projects. And just want to, this might come up again later as well, but HCB was just awarded 18 mainstream housing choice vouchers in Contra Costa County. And those are also set up for households with developmental disability, and it's not necessarily, it doesn't have to be the head of household. So we're expecting that the qualifying individuals, it'll be individuals and families with dependent children with a developmental disability, which is really cool. Again, it's the extra flexibility, and those vouchers will be coming online in 2019. So watch for that. There are some additional vouchers in Alameda County, but the details are a little more sketchy on how those will be allocated across disabilities and so on and so forth. But as we get more information, that will be shared through the HCB report on our monthly meetings. So before go any further, I'd just ask if there's any questions. Okay, I'll keep moving. What's the time?
It's 10:30.
All right, great. So one of the things we did was we looked at other states. What are they doing? We also looked at what other disability populations are doing within the state of California. And so that's the kind of the next section we'll be moving into. Now we looked at a few states: Illinois, New Jersey, Connecticut, Florida, and New York. And I've got just a brief summation of some of the things they're doing there that are interesting that should be considered here in the state of California. And again, these are states that have done something specifically for the IDD population. So in Illinois, they provide housing education about the benefits of community integrated housing. It's a very soft effort, but it is a statewide effort led by their state system for IDD services. In Connecticut, they created an interagency partnership to fund the development of supportive housing for IDD. And the IDD agency partners with the state's Housing Finance Agency and Social Services Agency to create a new capital program. So they've taken it the farthest so far. And their DDS is working with their housing community development at the state level to basically bring specific housing resources to the IDD population. And then their DDS directs the Social Services Agency, so they're slightly different setup, to commit the services for those folks. So it's a little more complicated than what we would have to do in California. I mean, simply in California, DDS and HCD just have to sit down and talk and work this out and dedicate some specific funds to an HCD program so that money goes out and directly creates units for people with intellectual and developmental disabilities. So that one's the Connecticut example is one that we're really trying to run with. New Jersey, their Human Service Agency partnered with the state's Housing Finance Agency to create a separate organization that administers housing access. We're not completely clear on how much dollar resource is connected there, or if it's more of a kind of a housing navigation process. But it's great that they're having that level of statewide collaboration. In Florida, they actually did a set aside of 5% of their low-income housing tax credit resources to support people with a disabling condition, including consumers with IDD. The state also earmarked grant funding to create a range of housing models for people with IDD, so recognizing that there's no one model that's going to work for everybody. They've actually funded some of that research so that they're going to create multiple models and figure out how to best fund those. But as I mentioned earlier, that LHA has been trying to get the California Tax Credit Allocation Committee to do a specific set aside for IDD, and they've always said no. And they've said no to every special needs population. We now have knowledge of a state that has figured out how to actually do that set aside. So we're going to run with that as well. And then in New York, they adopted a prioritization strategy that allocates housing and services resources for people with IDD according to the greatest need, starting with homelessness. So again, there's no new resource there, but it's lifting up IDD as a population that should have access to the resources that are shared across the state. Yes?
Darren, do any of these states have like in California, there's a difference in thinking about people who are getting services associated with cognitive challenges and mental disability versus intellectual and developmental disability. It's a whole different network in California, right? The DD community and mental health. Do you see that the same paradigm in these states, that there is that dichotomy?
That's different across the board. So because of the Lanterman Act, that's why there's the regional center system that sits separate from the county-based behavioral health systems. So I think the state of California's in many ways created those silos in the IDD communities benefited greatly from that because there are dedicated resources and that aren't necessarily shared across a whole human services agency, right? But it also when the behavioral health care folks create something like the Mental Health Services Act, where there's tons of money coming in from the millionaire's tax from Prop 63, we don't get any of it. So, obviously the Lanterman Act and the DD, the regional center system has meant that our folks receive a level of service far higher than most states, if not all. It has its issues as well. Does that answer the question? Okay. So now moving on back to California and looking at some of those other populations. So thanks for the segue.
Anytime.
So as you all may remember, Prop 63 about 14 years ago set aside funds through taxing one penny of every dollar over $1 million of earnings for an individual. So it was the millionaire's tax. It was the tax everybody wants to pay, and very few do. But the ones who do have been funding quite a bit of services and housing for the behavioral healthcare system throughout the state of California. And they've also successfully reallocated some of those funds back into capital for housing for folks that are chronically homeless with serious mental illness through the No Place Like Home program, which was, I believe it was it Prop 2 in the last election, and it was passed to reallocate those funds over. So they're now on their second iteration of housing investment for that population, and IDD has not benefited from that one bit in the East Bay, and slightly in other counties, but it hasn't worked for us. So that has been a reliable source of funding for their services and housing for it'll be 2 decades shortly. And it's a great example of what could happen for IDD and through the DDS system. So HUD HUD in the Veterans Administration created a supportive housing voucher that's used to basically buy into affordable housing developments. So that voucher allows a affordable housing developer to target very extremely low-income folks because they're coming with eligibility for those HUD VASH vouchers. And then there's also HUD capital dollars that are often paired with that voucher. So there are, the veterans homeless number is going way down, and it has gone down over the last decade because of these resources. And it's a great example of investment coming to great outcomes. But it's also hard for us in the IDD community because we're competing against these folks with all these resources. There's also a California version of the Veterans Housing and Homeless Prevention Program that's on top of the federal one. And then Los Angeles County created a flexible housing subsidy pool, and that's for supportive housing units. And that's it basically supportive housing units that are sitting within nonprofit-owned supportive housing, and wider range affordable housing, and master leased buildings, and as well as some scattered site units that are spread throughout the public or the private market for housing.
Can I ask a clarification on what you just said? You talked about competing. So let's suppose your agency wanted to be a part of a development project to create units for people with IDD. You could potentially lose out on the ability to do that because this HUD VASH monies would be more appealing to the nonprofit or the affordable housing developer than monies that you could bring to bear or resources you could bring to bear.
Yeah, and that also applies to the Mental Health Services Act. So those two are probably the ones that are the most difficult to compete against.
So in IDD, we are disadvantaged versus these other perfectly worthy housing groups.
Yes. Yes. Now, one thing, before all these other resources came to play, IDD was actually worked from an advantage, and the advantage was the service component. Because these services are typically 1 year renewable contracts that could go away on the services piece, which developers are not that fond of. Whereas with the Lanterman Act, we were able to march out and say, well, you know what, don't worry about the services. We have an entitlement, so on and so forth. And we didn't always talk about our fears of the entitlement, but we talked about how great it was. And that oftentimes got us into buildings. But with these capital and operating subsidies, we've lost that advantage on the services side. So what we're told over and over again is if we do have a dedicated source that's for capital and potentially an operating subsidy, which is a little harder to make work, we'd be at more tables, and we'd be getting chunks. We'd be getting blocks of units within affordable housing. I mentioned earlier that the community placement plan has successfully purchased set-asides in some buildings, and like the one we have in Walnut Creek. That's a perfect example of we had a resource and we were able to buy access. And that's a great, and that's happening. It's just that there's not enough CPP to really make a huge splash at this point. Okay, moving on. So moving on to the recommendations, we obviously need to improve the data and the planning. We need to enhance the statewide and local partnerships. We need to leverage our system funding to create housing opportunities. So that was exactly what Stephen and I just had a sidebar on. And ensure that mainstream systems address the housing needs of people with IDD. Yes. Hi, Dina.
Hi. What is HUD?
HUD is the Housing and Urban Development Federal Agency, and a lot of the affordable housing dollars throughout the country flow down from HUD. Okay?
So does the HIDD go into the HUD system?
Sometimes. Not enough, though. We need more. All right. So within these four categories, I'm just going to talk a little bit about each one. So what we're suggesting or recommending is that the IDD system should create a sustainable capacity to assess on an ongoing basis the short and long-term housing needs of consumers. So talked a little bit about that earlier. It would be extremely helpful if we knew everybody's housing situation and everybody's housing goals. Because from that planning, we could then determine where the resources should go. Okay? And otherwise, we're just taking a stab and we're saying we need 20,000 units. It's hard to, we can't substantiate that, but we did our best. The entire community should promote the use of data to plan and budget for assessing the unmet housing needs of consumers. So we really need to know that delta. What's the difference between where they are and where they want to be? And what's realistic? Where they want to be has to be a realistic option as well. You know, beach house in Malibu probably isn't realistic.
Oh.
Unfortunately, I'm sorry to burst any bubbles. Better data will offer more opportunities for our cross-system planning. So if we have better data, we can go to 8 housing and community development at the state level and really advocate, because we'll have good data behind us. Right now, we can say we have an unmet housing need, and we can throw a number, but they're not necessarily, that number doesn't help them figure out how best to allocate their resources. And we also feel that the IDD system should be sharing data with the key stakeholders like consumers, families, service providers, and developers to plan and budget to meet the needs regionally, excuse me, and statewide. And we really would love it if we could have some aggregate data, not specific consumer data, but aggregated across the state or across the various jurisdictions. If we could share that aggregate data with the mainstream housing sector, so the HCDs, the housing developers, and our local jurisdictions who fund housing. That if we had that broken down, like, so if I was able to go to the city, go to Union City and say, this is how many people live here or want to live here, and this is what we would need to make it happen, I'm going to have a lot more success in those meetings if I got that level of data. And so the next is to enhance statewide and local partnerships. That one's self-explanatory, but our the real push there is that that LHA's already started making those relationships, and we would love to be able to bring DDS and our local regional centers with us into those relationships. Yep, Dina?
I live in an area where there's HDs and Section 8s. When the price goes up, it makes them have to either move, they have to move out of the area, or they have to move to Pittsburgh, Stockton, anywhere they can. And it makes it really hard because we're trying to keep, some of us love where we live and we don't want to go out. We want to stay where we are without costing too much to our family.
So I think if I can paraphrase, what's happening is local housing authorities set their limit on what the vouchers will pay, and it's called, I believe it's called their contract rate. And that rate doesn't always meet the market rate, so well, it often doesn't. So landlords will choose to move their assisted unit rent up above that contract rate. And so what ends up happening is the tenant, instead of paying just 30% of their income, which is how a voucher typically works, they're paying 30% plus that delta, the difference between the contract rate and the rate set by the landlord. And that does force folks to make changes sometimes. Sometimes the amount is small enough that it can be absorbed.
Is there any prohibition on people getting that amount contributed by family?
I think, no, I don't know that the landlord or the housing authority would care so much. It's SSI that will care.
So that would have to be contributed through like an ABLE account.
Exactly. So an ABLE account could definitely meet that need in between. But that's my understanding, is the issue is more with their benefits entitlement. Yes?
I've been following that car fire that they had in Reading, and now the campfire that's not too far from there. And it turned out that the agency that we have for our boys, the couple that own it, their house burnt down to the ground, but they were able to save their business as well as all of, in the car fire, all of the needy people that they had registered in homes, they were all saved. But
Well, they're very lucky.
yeah, but in the campfire one, a lot of the people who were living in homes, needy people, lost their homes. And so the company in Reading that we're associated with is Compass. And I was talking to the girl who started it last week, and she told me that they're going to try to help those people in the campfire, but there's apparently quite a few. I was wondering if any of this can be.
I think most, if they were probably living in, I'm guessing they were probably living in licensed facilities, so it's going to be more of an insurance and a FEMA effort to replace their housing for the permanent piece. If they were living in an independent, affordable housing setting, again, it's going to be an insurance and FEMA process. And unfortunately, as folks are becoming aware that you don't get 100% of your value back, and you may not be able to build back to the scale you built before. And I haven't heard of any affordable housing developments that were lost. I'm sure that it happened. And if there's investment from any of these other sources, they're going to want to make sure that those units are brought back online, because they're held to a regulatory agreement, and there's catastrophe, things in the regulatory agreement, but the sponsor who used the money to create the housing is on the hook to recreate it and make it whole. So hopefully those things will happen, but we're talking about construction, and that's going to take some time, and it's a really tough situation.
Where they're staying now, but that's what she told me.
Darren?
Yes.
Could we ask Lisa, do you mind if I just interject? Do you want to give an update? I know there were 200 far northern clients that were had an acute housing need. I was on a call, and they were trying to decide to work with DDS or FEMA, which would be the quickest solution.
FEMA was taking a really long time to get trailers out there, because actually quite a number of the people who were impacted were living in trailers, independent living, that sort of thing. So people were actually staying at shelters, and some people did move out of the area with family members. They are working on just making sure people are safe in housing that's not in the areas that were burned out. There were actually a number of service providers in Paradise that lost their sites, and it's also up there impacted the workforce. So there were many people working in our service system who lived in Paradise and around. So it's a big impact there. And Far Northern, this is their third disaster over the last year. The dam issue, the car fire, and now this. So they're educated on it.
Painfully.
Oh yeah. Far Northern Regional Center set up a GoFundMe link on their website to donate money, kind of like our Regional Center Helping Hand Fund, where there would be money available just to give gift cards, things to support people throughout the recovery from the fire. And they've been getting a great response. It's really an important way to help people at this time.
Hey, close too. No. And going back to what you said before, how long will it take
to get them back online. You say something about that part, but I asked you how long do it take?
It's gonna, so rebuilding from fires like this.
No. I mean, internet. You said internet.
I'm sorry.
It take long.
So online I meant back, being rebuilt and being reoccupied.
I see.
And it's, you know, it's at least a 2-year process, because I mean they're right now they're just cleaning up. They haven't been able to start building.
But last year and this year.
Yeah. So from prior fires, they're in the rebuilding process already, and like the North Bay fires, a lot of recovery is already happening. Yes, Tina?
A lot of us got affected at Creative Growth where I work, and some of us are actually doing pictures. If Lisa wants to come over sometime, we have been drawing, I've been drawing, and a few of us have been drawing pictures of what it feels like, us disabled who are not in the fire area, but the ones who are, how it feels. And I've been drawing some pictures of how I've been feeling about the wildfires.
I will stop by and see that one day. Thank you.
Yeah, thank you. Okay, so just on this enhance the statewide and local partnerships, I want to point out we've got a great opportunity right now with the Alameda County and Contra Costa County Housing Authority's Mainstream Voucher Awards. And so we just kind of kicked that off this last week with the regional center. It gives us a great opportunity to learn from have each of these systems learn from each other and find ways that we can work together to meet each other's goals. And that's, I feel like, a great opportunity. I don't know how, if it's going to be something that's going to occur statewide, but at least we can make the example here. And I'm hopeful that through LHA I'll be able to share this experience with the other NPOs in ARCA, and that way we can see if we can take advantage of future opportunities where these vouchers become available. Leveraging existing IDD system funding. I'm going to tie this one up fairly quickly, and then we're going to wrap up soon. We'd like to find ways to make sure that the regional centers and service providers are maximizing the use of the new service code 089 for housing services. And it's this is something brand new. I think you're just getting direction from DDS now on how that would happen. And we see that as a huge opportunity to make sure that folks have the resource available to navigate the housing search system beyond what they can receive from ILS and SLS, but maybe a more coordinated regional effort to get people connected to the available housing out there, because it's not an easy process. And then if you throw in housing authorities and so on and other agencies, it gets even more complicated. So we're hopeful that there's going to be a lot of good movement with the new service code. And we're also wondering if there's a way to take advantage, well, that's the wrong word, make lemonade out of the fact that there are licensed group home operators retiring and aging out of the system. It means that there's real estate, there's real property where they were providing their group home setting, that whether maybe it doesn't transition into a group home, but maybe it transitions into a shared housing model. We feel like we already have an example of that. We did that at the Luella Fuller Group Home in San Leandro. It transitioned from I think a level 3 to now four unit shared housing model. And it's a way for us to add another option into the housing milieu for folks. Shared housing is not for everybody. I'll attest to that. but it is great for others. Some people really thrive in that shared housing model. And the difference from a shared housing model from a licensed model is that, for one, there's no staff, so it's a different level of independence. Each individual has a key to the front door, key to their unit. They share common space, which could be bathrooms, but definitely sharing kitchen, and then living room, family room, and all that. There's laundry on site. There's all these just opportunities to maximize independent living options. And our property does have a resident manager who's there in the evenings. And a big chunk of her job is just kind of managing the household, making sure that chores are getting done and mitigating conflict, as will happen with roommates or housemates. But it's really exciting to see folks who wanted to get out of their family home or wanted to transition out of a group home, and they had an affordable place to live. So we have all this housing stock. And the other great piece is if we could make this happen, this transition happen, is these homes already have accessibility improvements built in. And that's key, because then if we can eliminate those hurdles, you saw through the surveys that was a huge issue for everybody that responded, is the lack of accessible units. Whether they need them or not, it's identified as an issue. And so, and I'll just go back to the mainstream voucher piece is, if we could get all the housing authorities across the state to recognize the need to incentivize or to prioritize our folks, the IDD folks, that's going to move all of our folks up those lists, those long wait lists, and get in so that they're getting access to vouchers in the near future versus the maybe nevers. Okay. So in conclusion, I want to just mention that LHA is currently working with the Lanterman Coalition on legislation that would create a dedicated source to fund capital for affordable housing development for the IDD community. Most of those funds would be used to buy into set-aside units in larger projects, and then other smaller models would also be eligible. And a lot of so this is a kind of a remake of the Lanterman Coalition's 1990 bill that didn't make it out of its original House last year. And it's what we're doing is the core of that bill was solid. And it identified the source, and it was DD sales and DD savings. DC sales and DC savings was going to fund this piece. And whether or not that is our source going forward, we're not completely sure. We may look at some other options, but the main goal is to use what we learned through the strategic framework to flesh out this bill. And we're hopeful with the strategic framework is attached to this bill that we're going to have more success in this next go-round. And you're going to hear more about it. We won't have a bill number until probably February. That's our goal. And but I'll make sure the East Bay Ledge Coalition is paying attention to this one. Thanks, Ron. And
Question, Darren.
yeah.
It's like, who's the author, or who's going to be co-sponsoring it? Do we have anybody yet?
We don't know yet. It may, I believe, was it Mullen that did 1990? I think it was Mullen. So he's interested, but I don't. That's not identified yet.
Well, can I just interject that we do have Simone here today, staff from Assemblymember Canson Shu's office, and if he's looking for co-sponsors, we know who to see, right?
Fantastic.
Yes, Lisa?
I hear that in San Jose, there was money dedicated to housing, and none of that was really targeted to the IDD community, but they've gone back to the Board of Suits there to get some targeted money to the community. So maybe on a county-wide level too, we might want to
Yep, that's a great success. It's a great example. And again, it's the type of thing that that happened after the strategic framework. We're trying to find a way to maybe to slip that in as a little capsule, because it is a great example of local advocacy. And right now, San Jose is investing a tremendous amount of of financial resource. So any portion of that will be incredibly helpful for IDD.
But so they have a lot of parking, but I just stop going on too. Yes.
Yeah.
What I'm hearing, more stuff is happening in Zay than happen on the campus, or that more talking about more houses and more about the homeless. Because a lot more homeless there have nowhere to go.
Yeah,
they try to follow Oakland, but they are not follow Oakland. We need to follow what they doing, but they need to catch up with us.
Well, yeah, I mean, that's an interesting argument. I don't know if anybody's actually in the lead in sufficiently addressing the housing.
What I mean.
Yeah, everybody's being left behind. So, that's the only equal opportunity piece we've got going here. Is every jurisdiction is floundering in many ways. But what I think the point I don't want to lose the point that Lisa made is that in San Jose they released all these funds and there was no set aside for IDD, and they were able through advocacy get that set aside attached, and that's a model for the whole state. And one of the ways they did that is that they actually are tracking homelessness through SARC, and they have a much higher number. I don't know what it is, but it's actually higher than the statewide number that was reported in 2015. I'm pretty sure that's how they got. That was a linchpin to that argument.
And I think there may be something about how we all define homelessness, because I think when someone is, living with family, but that's not a stable situation, for a lot of definitions of experiencing homelessness, that counts.
Yep.
So I think maybe we have to identify and name that in a different way.
Yep. And that's part of that statewide data piece that will be coming through the strategic framework, is coming up with a system definition that will also translate easily to all the other systems, and then we can get a real number, and that real number, I don't know if I want to see it. I mean, I think it's going to be much higher than anyone would be comfortable with, but it is key to making these funding arguments.
Can I interject one thing? So I do agree with Lisa completely too, and I'm on the Public Health Legislative Council, and we just did our updates for the county legislative platform. It's a 119-page document. It's a little bit too long, and we just found out that, the county administrator's office just set new priorities. They're called 10 times whatever goals. And homelessness is one of the priorities. And that's how I think we should approach the Board of Supervisors. I think that's great. But do you know what other priority that they have? It's a county priority. Competitive integrated employment. I've got to tell Rose that. I mean, that's amazing for a county to have. I think that's only that language is unique to the developmental disability system. I don't think mental health uses it, so it's like, wow. But that's, homelessness and housing.
Get them put together.
So just as a reminder, we do expect the statewide strategic framework to be released in January. The final draft is 77 pages. It's not quite as big as the county's ledge platform, but it's, I don't know what the final is going to actually look like, but again, we're very excited to be able to roll this out. I'm not expecting everyone in this room to read it, but I appreciate you sitting through this hour or whatever and getting most of the highlights and hopefully not too many of the lowlights. Steve?
Darren, I have a political question. Will the lack of, or the shortage of respondents to the survey in terms of being statistically valid hurt the effectiveness of it? In terms of lobbying politicians to take action? In any regard?
No, it's because we have, I think it's a good question. We're not going to be upfront necessarily with our actual numbers. I won't be sharing, or we won't be sharing as much of the detail as I just shared with everybody on that. We're going to somewhat gloss over that, but our number, because there was such a wide array of respondents, the 8 categories, and it was every category was filled. That is kind of what we're pointing to, and that we're getting very similar responses across categories. It's the bottom line is lack of affordable housing, lack of accessible housing, and lack of financial resources for the individuals. That played out all over the place, and that's the mantra that we're sticking with. And we can continue to redo that survey and build up those numbers over time and just update. Okay, thanks. Oh, one more?
Yeah, I would just, I was going to ask actually, how you kind of look at this health factor or safety?
Yes.
That came out highest. Okay. I wanted to ask about how, in digging deeper into the details of this, how you might plan to look at the highest priority for housing being safety, because it seems like that's really important too.
Yep.
And harder to define than affordability.
Yeah, well, so safety in the housing values piece, from my perspective, and I'll be very clear, it's from a developer perspective, safety is going to be about location of the housing, and it's going to be about the security of the building, and it's going to be about the property management staff and services staff, how they operate within the unit. That's from my developer piece. I think there probably are different perspectives in the room, and that might be something we need to look more into. Because that was a bit of a surprise, that bump that jumped above all the other stuff. Dina?
Well, some of the old houses, like where I lived, and some of them, and colleges and stuff, don't have the ADA access, don't have the proper access to the levels to where they are, should be.
Yep.
And so
All new built construction will get us there, and depending on what kind of funds are going in, you could have some buildings are going to have a requirement of 10% accessible units within a new building, but the main thing is that also all the amenities are fully accessible. So I can't necessarily speak to all the older buildings, because it can be quite expensive to retrofit to accessibility, but there needs to be some investment in that for all obvious reasons.
Yeah. Well, as a parent, when I hear safety, it makes me think about how my child with autism, nonverbal, developmental delays is going to be treated by staff. That's kind of what kind of it says to me, and I wonder if that's a part of it. With everything that incidents we're hearing about kids being not, or adults, individuals being mistreated. That's kind of, for me as a parent, that's my safety concern for my child. She can't speak up for herself.
Right. Well, and that's what I was kind of trying to touch on that with the management and the services component, that they're fully trained and capable, right? And that's one of the things is the properties that we manage, our property managers have the same, basic level of training on working with folks with IDD that the service component has. Obviously, the service component, it goes beyond, but we want our property management, our janitorial, our maintenance folks to be operating at at least this baseline level of understanding and compassion and all that other stuff. We can't if we're purchasing set-asides within other people's buildings, that's a little harder to mandate. So I hear you. But if we're able to get some of this set-aside language into some of these funding pieces, we could actually add that into the criteria for funding. So that's something I'll tag here in my notes.
And I would just like to piggyback, because I'm in the same situation, that there needs to be better accountability. So it's not just a roof over somebody's head. The staffing piece for the individuals that need staffing, like my child, who can't tell me anything. So the accountability, not just the training, but how the staff is accountable for what is being done and not being done, like medication administration, for example. Activities outside the home, that kind of thing. The other two things that I don't hear are safety net situations, emergency placement. The options are very limited. And the idea of some mechanism of getting families or guardians or whoever's responsible for the person in communication with each other, to be able to, if people have similar needs in terms of housing and support services, everybody's in an individual bubble. Not everybody, but many people are. And being able to have some sort of collaborative effort without, with the confidentiality piece being taken into account, and people don't want to, having some sort of collaborative effort so that families with similar needs can get together.
So, yeah, let me hit those 2 points. So the safety net emergency placement piece, it was not part of the scope of this at all.
But it should be.
Well, and possibly. I mean, this was really about creating more independent and affordable housing options versus crisis response. And so I understand it needs to be addressed. I'm not sure this is the place for that, because it's kind of a completely different component. But the families and the cross support piece is a great idea, because it would be good to be able to activate networks, not locally as well as across the state. As we get into the data and get a little deeper into where folks want to live, and then what kind of things they need in place to make it successful, those natural networks will develop, and we also need to actively make that happen, because that's the only way that the housing world is going to fully understand what they need to do to make it work, is getting that information from networks like that.
And there already are some networks like that, like Sunflower Hill, like Big Wave Project. There already are some families with similar needs that have created their own networks. And there's some in Southern California as well.
Darren?
Yeah, and then we have to wrap up, so this will be the last question.
Okay. It's more of a deal with the family question regarding the respect and dignity. That's one of the jobs that I do over the office. I have several rights trainings in respect continuity programs that I already do, and I have to go periodically. I go to all the home day programs, so it's already being done. But of course, it's only one person doing it right now. But it's out there, and believe me, in my training, these people do ask the question, and they want to know. In fact, I got to give a training next month to a brand new provider, and when I give these trainings, I make sure that they understand before I leave. And I always use, I gotta come back, you're not gonna like it.
He's a
So it
resource,
gets
use
done,
him.
yeah. So it gets done. These respectable training programs get done.
Okay, wrap it up. Thank you, everybody.
Yeah.